All right, well, we want to welcome you all to our third annual VegFest Houston, and it's my pleasure and honor to announce our next speaker, Dr. Baxter Montgomery. He is our local resident vegan cardiologist here in Houston, and I just want to announce some of his credentials. He is the clinical assistant professor of medicine in the Division of Cardiology at the University of Texas and a fellow of the American College of Cardiology. He's also the founder of Montgomery Heart and Wellness and the author of The Food Prescription for Better Health. In addition, he is the recipient of the 2010 PCRM Physicians Committee for Responsible Medicine Award for Compassion in Medicine, and one of my friends. Please welcome Dr. Baxter Montgomery.
Thank you, Kirsten. Well, good morning. I think I need to stand far from this microphone. I had to get the earpiece because I wanted to walk around because I wanted to show off my new sneakers. I hope you can see them from the back. They're bright orange. And you see a middle-aged man wearing bright orange sneakers, that's the sign of somebody in midlife crisis, but he's too cheap to buy the Corvette. And so I'm going to talk to you this morning about a paradigm shift. I've got about 500 slides to present in about 25 minutes, so we're going to fly through some of them. But it's an important message. For those of you who want to get a copy of our slides, and I'll send this slide up, you can text messages. We also have a booth if you want to get a copy of our slides and some of the information. We'll email it to you. As Kirsten mentioned, my day job is I work in a medical center as a cardiologist and treat patients who are sick with various chronic illnesses. But my passion is linked to what I'm going to talk about today, which is helping people either prevent or reverse these chronic illnesses naturally. In an overview, I'm going to start off with a clinical story, and we're going to talk about some aspects of the perspective of the medical center that we have here. I'm going to give you my perspective on the nature of our problem and talk about why we're sick. And we're going to talk about a hypothetical patient, Jim, with a sore thumb. And then we're going to go into some other concepts in terms of what we need to do to make a change and how to make things better. This slide is to remind me to inform you that we're here in Houston, and many of you, some of you may know this and some of you may not, but we have the world's largest medical center right here. I mean, it's just, a stone's throw away from this building. And a lot of great things happen here. This is an old picture. This has grown much more since there's many more buildings since this photograph was taken. Here we are at Montgomery Heart and Wellness, right in the shadows of the Texas Medical Center. So that gives you some perspective in terms of the standard of care of medicine and what we're doing at this day. But let me start off with a clinical story. It's always important to try to put some framework here. And many of you have heard me talk before, and I've told this story before. But this is a 69-year-old lady who I saw early in my practice. She came in because she was having dizziness. And she had a chronic history of diabetes. She had chest discomfort, hypertension. She was overweight. She had carpal tunnel syndrome. We evaluated her medication. She was on many medications for blood pressure, diabetes, cholesterol. She was taking medication for constipation, probably from side effects of some of these other medications. Because of her history, we had her evaluated. Of course, she was diagnosed with a brain tumor, and the dizziness was due to the brain tumor. So we had to do a preoperative assessment of that. Our preoperative assessment revealed that she had a blocked artery, and she underwent an angioplasty and a stent placement, and that was successful, and we were excited about that. She underwent surgery, had the tumor successfully removed, and she did well after that. So here we were in the medical center. She had gotten the best of care. She had defeated coronary disease and also had a tumor successfully removed. And we were feeling good about ourselves. But there's more to this story. And those of you who've heard this story before, you know a little bit about it. But there's an extra twist to that we'll go over. But let's go over this, the nature of the problem that we're dealing with in general. And let me just give you a few slides that give you some idea of what that problem is. This slide talks about the percentage of the population that has heart disease as we get older. As you notice, the bar graphs get taller as you go from the left to the right. That corresponds to the increased age groups. The small set of bar graphs are age group men and women, 20 to 34, men and women 35 to 44, 45 to 54, 55 to 64, 64 to 74, and 75 plus. As we get older in our populations, there's a greater percentage of us who have heart disease. The other thing that this slide tells us that in the blue bar graphs, they're men, and the brown bar graphs are women. At the younger age group, more men have heart disease than women. But as we get older, something happens around 45 to 54. Women catch up and then they pass men up. This shows that more women have heart disease than men. Heart disease is a woman's disease now. The other thing that this graph shows you is what it doesn't show you. If you look at this age group here for men and women 20 to 34, it shows that about 11% of men have heart disease. But we know from autopsy studies, there's one autopsy study done back in the early 50s, when they looked at the hearts of American soldiers, American male soldiers who died of traumatic injuries in the Korean War. They autopsied about 3 hearts, they looked into hearts, and about 78% of these men had gross coronary artery plaque. That's about 300 hearts. These are men who are age 22. The average age of that group is 22. They've subsequently done other autopsy studies and shown similar numbers. So if you look at autopsy data, men age 22 are in this age group. It's not 11%, but it's really 70 to 80%. So if you take this bar graph and you start here, and you take the tail of my arrow and you start here instead of here, and then you go up, what is the percentage of heart disease in the rest of these age groups? It's practically universal. So if you look at the standard American population, virtually everybody has some form of heart disease, certainly beyond the age 30, 40 years old. Very, very troubling data. Now, if we look at other diseases, hypertension, as we get older, the bar graphs, the same story. I can overlay any chronic illness, arthritis, headaches, whatever, weebie-jeebies. The bar graphs will get older as we get higher as we get older. Additionally, if you look at diabetes, if you look at our overall population, now this is population data, not age, from 1980 to 2010, we have an increased population, increased percentage of people in our population who are becoming diabetics. The same can be said for obesity and the like. So we're getting sicker as we get older individually, and we're getting sicker as a population across all ages. And so that's troubling. Same thing with kidney disease. It's more renal failure. Over time, it's projected that there's roughly a 10% increase in individuals with renal failure. And many of you may notice that there are dialysis centers being put in all the neighborhoods. In fact, dialysis is now thought to be something that's attractive. They're calling it a dialysis spa. You know, you get your toenails clipped and paint and get your dialysis done. And so it's a problem. So the state of our health is simply we're sick. We're sick as a population and we're getting sicker. So why are we getting sick? Let's ask Jim. Jim is a hypothetical patient who's come to my office, and this is a vice grip for those of you not mechanically inclined. And Jim came in, he had a complaint of a sore thumb. His thumb was sore for about 2 weeks. And so I take the history and I said, well, you've had a sore right thumb for 2 weeks. It says, when did it start? He said, well, I had a vice grip clamped on it 2 weeks ago and it got stuck. And I said, okay, have any family members had thumb problems? He says, no. Have you had thumb problems before? No. On physical exam, I examined his heart and lungs, and everything was normal except the right thumb was red, tender, and swollen. Left thumb looked okay. So I pulled out my prescription pad and prescribed 200 milligrams of Motrin every 8 hours. Tylenol number 3 every 4 hours is needed for pain. And I said, take this for your sore thumb, Jim. Come back and see me in 2 weeks and see if you're better. So he gets his prescriptions, walk out of the office, vice grip in place of the thumb, prescriptions in hand, and he goes off, comes back in 2 weeks, says, well, I had about a week and a half of pain relief, but the swelling started getting worse, and now I have constipation. I said, oh, really? He says, yeah. Well, since his pain's getting worse, I decided to increase the Motrin. I changed the Tylenol to Tylenol number 4 for increased pain control, and I prescribed him lactulose for the constipation. But I did some blood tests for his kidney and liver because I know the Tylenol and Motrin could affect both of those organs. And so I'd come back and see me in 2 weeks. So on visit 3, he comes back. He had partial pain relief, continued increased swelling. He had slight worsening of constipation. But then I looked at his blood work and I saw he had some abnormal kidney and liver problems. So I was concerned about that. So what I did is I changed his pain medication again to control the pain. I continued the Tylenol 4. But because he had kidney and GI problems, I referred him to a specialist for follow-up. So again, he walks out with his new referrals, prescriptions, ViceGrip still in place. And I said, follow up in 6 weeks. Are there any suggestions in the audience in terms of what you do next? Yes. Take off the ViceGrip. All right. You don't like my therapy before? No. I'm a board certified cardiologist. What's the problem? Yeah, remove the ViceGrip. It's kind of a silly scenario, right? It's ridiculous. And the problem with it is, it's ridiculous, but it's true. Because every day we walk into our doctor's office with elevated blood pressure, elevated cholesterol, headaches, chest pain, etc., and we fail to remove the ViceGrip. We write prescription after prescription, procedure after procedure, and the ViceGrip of those chronic illnesses is a standard American diet. It's the bad food that we're putting in our systems. And I will show you data later in my presentation to show by simply removing that ViceGrip, by simply removing that bad food, these illnesses go away. And it doesn't take years to months. It takes days to weeks. And it's almost automatic. So yeah, that ViceGrip is there, but this is the way we practice medicine every day in this Western society. And we need to make a change. A paradigm shift is needed. So let's look at the nature of the problem. What are we eating? Here's a little perspective. We've done this before. If you take, I'm going to do a little survey. If you look at the average amount of food the typical American eats, in about a week, you get something that looks like this. As a family of 4. If you go to Italy, you might look like something like this. You go to Egypt, the table will look like this. Again, a week's worth of food, a little bit increased number of people standing around the table. Here it is in Ecuador. And notice how the packaging has changed. In Bhutan, here's a week's supply of food. Notice more people standing around the table. And they're still smiling, so they're happy with what they have to eat. And here it is in Chad. Again, still smiling. A week's worth of food. So that gives you a little bit of a perspective in terms of what we eat compared to the rest of the world, and then you wonder why we're spending such a high percentage of our gross domestic product on our sick care, because we're feeding our sick care with the poison. But let's really analyze our food. If we look at from 1909 to 2005, the amount of meat per capita has increased significantly, from about 150 pounds to over 200 pounds. And if you say most people are eating less red meat because we've taken up with chicken. Now, those Chick-fil-A commercials are pretty impressive. And I think they've had an impact. But notice how this graph parallels graphs I showed you earlier. Remember the graph of the increasing diabetes, almost exponential. You can almost overlay the chicken graph with the diabetes graph. Look at the amount of cheese we're eating. Okay, almost tenfold, in that period of time. So it's really problematic. The sugar. Now everyone talks about how sugar is bad. We have an increased amount of sugar in our diet, but notice that it's less of the cane and beet sugar, which is the more natural sugars, and it's more of things like high fructose corn syrup. So we're eating more processed sugars in all of the fast foods that we're eating. But let's really analyze our food. A picture's worth 1,000 words. Anybody want to have steak for dinner tonight? Are there any meat eaters out there? All right. Basically, this is what you're getting. This is a rack of something. And there's a cancerous tumor with pus coming out of it, just for those of you who can't see it. Now, don't worry. They scoop it out before they cook it. And they leave just a little bit in there for flavoring. And then, and you don't see it, and they put little, dressings over it, so it's okay. And a little barbecue sauce, you don't know the difference. So don't worry about it. In case you're going to have steak dinner tonight. But food is a very important thing, because we can't overestimate the importance of understanding what food is. Foods are complex chemical substances, okay? They can be nourishing, or they can be non-nourishing. In other words, they're going to benefit you or be detrimental to you. So I looked up a few definitions. Excuse the busy slide. Webster defines food as any nourishing substance that is eaten or drunk or otherwise taken in the body to sustain life, provide energy, or promote growth. Now, that definition of food implies something that is good. Now, if I eat a piece of, whatever, fried chicken, and it runs my blood pressure up and puts me at risk for stroke, is that nourishing and promoting growth and health? No. Then it doesn't meet the Webster definition of food. If I eat some pus cancer-laden steak, and it runs my cholesterol up, does that sustain my life and provide me with energy? No. So there are many things that we're putting in our bodies that we're calling food, but not meeting the definition of food. And so we have a little definition in Montgomery Heart and Wellness that foods are complex composition of complex chemical substances that when we consume, they can have either a beneficial or adverse biological effect. Now that can encompass your steak. Now the steak will have an adverse biological effect. The spinach will have a beneficial biological effect. You can choose what effect you want to have on your body. Now we conveniently have different types of nutrients. Now these divisions are arbitrary. And I don't know if any of you have read Dr. Campbell's new book, Whole. If you haven't, I highly recommend it. I'm going through, he does a great job in talking about how we artificially separate things in sciences when there are many things they're much more complex than we make them. But just for simplicity, we talk about proteins, we talk about carbohydrates, we talk about fats as macromolecules. We also talk about minerals, vitamins, and phytonutrients, and these are all substances that are beneficial to the body. But I want to talk about one nutrient that's really the most important nutrient, and we overlook it. That nutrient is water. The human body in its healthy state is made of about 70-75% water. Okay? Water is a chemical compound that consists of 2 hydrogen atoms and 1 oxygen atom. It's the universal solvent. There's some unique things about water compared to other liquid. Water is one of the most essential elements good for good health. It's good for muscle tone, oxygen supply, nutrients, it rids the body of waste. It's the only substance that exists in a liquid, solid, and gaseous state in biologically livable ranges, which is very important for us. The human body is made of 70-75% water. Who knew that muscle tissue is 90% water? Okay, you get these bodybuilders and they want to eat all this protein, but really it's 90% water. That's with muscle tissue. But what about your protein? I get this question all the time, and I know some of you vegans, you get this question. Where are you going to get your protein? Everyone's asking a question about protein. Whenever you get that question again, number one, your response should be, idiot, that's the wrong question. The number one nutrient and most important nutrient they should be asking about is water, for what I mentioned earlier. But let's talk about protein, since everybody wants to talk about protein. And oh, by the way, when people say protein, they don't mean protein, they mean dead animal flesh. So let's talk about our dead animal flesh. So what's in dead animal flesh? Well, you have nerves, fat, muscle, internal organs. It's hard to separate these things. When you cut off, muscle, you got nerves and all sorts of things. You got blood vessels, animal excretions, you got milk and blood and urine and feces and pus. And all that good stuff is mixed in with your animal flesh, protein. And that's if you get the quality protein. Now, we're not going to talk about the meat that they get when when they scoop up the dead animals from the street and grind it up and mix it in with the human meat. That's also some of the bad stuff we get. But let's talk about the high quality animal protein. What if you get the organically grown cow, the organically raised chicken, all the happy cows, you massage their backs and all of that. They're not treated poorly. Even these animals are poisonous because there's a molecule called the new 5-GC molecule, and this molecule isn't metabolized by human beings. Actually, it triggers inflammation in the human body, and it's been associated with cancer and heart disease. So the inherent properties of animal protein, even in its best state, even as the best raised state, is poisonous because it's not meant for human consumption. And so if you look at casein protein, we like to talk about milk. And everyone talks about the fat in the milk. They say, well, what if I drink low-fat milk or no-fat milk? Well, it's not the fat in the milk that's the problem. It's the protein in the milk. Milk has serum bovine albumin, cow's milk, or casein protein. And casein protein has been shown to be associated with all of these illnesses. You have arthritis and acne and atherosclerosis and stomach bloating and bronchitis and chest infections, eczema and hay fever, hemorrhage and hypertension, etc. And we consume the dairy products. These conditions occur. We then go and take the pharmacological products to treat these conditions, and then we go back and consume the dairy products to perpetuate the condition, then go back and take the pharmacological agents to treat the condition, and take the dairy products to perpetuate it. We're in this vicious cycle. And as we go through this vicious cycle over and over and over, the cash register is ringing and ringing and ringing, and our national debt's going up because we're paying for all of these illnesses. Okay? A terrorist will not defeat the United States. Our knives and our forks will defeat the United States because we're going to eat ourselves into an ever-progressing national debt because everybody is sick and getting sicker, and we're perpetuating our own illnesses. Now, no dead animal flesh? Well, what are you missing? People say, well, if you're not eating chicken and fish, you don't have the complete protein, you don't have the complete nutrient. Well, let's analyze this. Let's take about 500 calories of plant-based foods and 500 calories of animal-based foods and see what we have. Well, let's look at cholesterol. 0 for plant-based foods, 137 milligrams for animal-based foods. Let's look at fat. About 4 grams for plant-based foods and 36 grams for animal-based foods. And by the way, the body can make its own cholesterol. Protein, look at about equal there. So you're not losing out on protein. That's supposed to be the biggest advantage here, right? Well, let's look at some of the other important nutrients, the phytonutrients. These things help fight cancer and help build the immune system, help you look happy, etc. Beta carotene, look at that, almost 30,000 micrograms versus 17. Fiber, anybody want to poop on a regular basis? About 31 grams versus 0. Vitamin C, 293 milligrams versus 4, and on and on and on. But that's only part of the story. It's only part of the story because some people will say, well, I'll eat my dead animal flesh and take a vitamin supplement. These nutrients come not only in the quantities that we see them, but they come packaged in such a unique and fascinating way that the body recognizes them and the body naturally heals itself. If I walk out into the sun and I'm at risk for radiation, cancer, and one of my DNA molecules gets whacked by radiation, guess what? My body has the ability to repair it because it's properly nourished. Now, if I'm eating this, my blood becomes alkalinized, so that predisposed to a cancer environment. So I'm feeding the cancer here, but I'm actually fighting the cancer here. Now, so what's our current approach? I'm going to go quickly through some of these. I know my time's running short, but pills and procedures. More than half the individuals who are on insurance have prescription medications. If you add over-the-counter medications, it's about 80%, maybe 90%. We do somewhere around 1.3 million angioplasties as of 2006, and I think this number is held steady. May have dipped only in the last few years. This procedure most of these are done electively. The elective angioplasties have not been shown to be clinically beneficial than not doing angioplasty. We have many other surgeries. Gastric bypass surgery. Obesity is a problem. We have surgery. We can put a sleeve on your stomach or cut it in half. We can treat hypertension with ablation, or we can do a pancreatic transplant for diabetes, et cetera, et cetera. But these things have astronomical cost. Okay? And so medications and surgeries are the mainstay, but we're not treating the illness. We're only palliating the illness. So the food as medicine is an important concept. The key concept, I have a few slides to talk about this. The critical thing about food as medicine is the first step is to remove all bad foods from the diet. Okay? Because remember, there are two sides of it. There's a nutritious aspect, and there's a poisonous aspect. So step one, you have to remove the poor nutrition because the poor nutrition is feeding all of these illnesses. There's a picture of a tree, it's in my book, arthritis, obesity, diabetes, headaches, hypertension, allergies, etc. And you can type in whatever your illness is on any blank leaf. These are all the same illnesses. They're all rooted in poor nutrition. You cut it off here and they all go away. And we see this in our clinic. We see this all the time. This is not hypothetical. This is realistic. So a two-step process. If you look at the bottom of the slides, nutrients greater than waste equal health. If the waste exceeds the nutrients that you put in, that's going to equal illness. It's as simple as that. Put more nutrition in your system, your body will naturally heal itself. Here's a diagram. Here's what we normally do. We put a large amount of toxins. The body detoxes on a regular basis. Oftentimes my patients will come and say, well, doc, I bought this herb off the shelf at the health food store. It's a detox herb. Okay, does this work? And I said, well, that's fine. But your body is naturally designed to detox. The problem is we put in such a large amount of toxins on a regular basis, we tox in excess of the ability to detox. So when we put someone on the detox, what we do is we remove the toxins. That's called a detox, because the first step in detox is to not tox. So we take this out. And when you do that, then the body detoxes at a very rapid pace. As simple as that. The body does all the work. So we simply need a paradigm shift. The paradigm shift starts from the mental aspect of things, okay? The healthcare costs continue to rise, medical advances, and we have wonderful advances. I work with some of the smartest people around. There's a lot that we're able to do, but these high-tech therapies don't reach the average person, and if they did, we couldn't afford to pay for it. I wish I was the first one to think of this, but other people, Thomas Edison, once stated, doctors of the future will give no medicine, but will interest her or his patients in the care of the human frame, proper diet, and the cause and prevention of disease. Okay? We're primarily treating the side effects of the bad food that we eat. Okay? Let me go through some of these slides quickly, and I want to pay homage to some of our founding fathers. Dr. Morrison, years ago, back in the 1940s, did an experiment where he took individuals with heart disease, and he followed them for 12 years. He had two groups. And then one group followed the normal diet. A second group of 50 people had an experimental diet that reduced the amount of animal protein. He didn't even remove all of it, just significantly reduced it. And after 12 years, he had about a 38% survival benefit in the experimental group. Everybody that was eating the dead animal flesh was dead, and this group had about a 38% survival. That was pretty impressive that he did that. Many of you know Dr. Caldwell Esselstyn. He's been here lecturing in our community a number of times. He did a study in 1985. He had 23 patients initially. 5 dropped out, 18 continued on his program. He followed the 5 along with the 18, and essentially what he found was that he had a decrease in cholesterol in those who followed the plant-based diet from 246 milligrams to 132. He had a decreased number of chest pain, decreased number of coronary events. Some individuals who had angiograms, I think 11 of those 18 had angiograms, they saw a 7% reduction in the amount of coronary disease, plaque in the arteries. The 5 individuals who stayed on their standard diet had more events over that 10-year period of time. Dr. Ornish had a similar study, a lifestyle heart study. He used nutrition and things like exercise, meditation, and relaxation techniques. He did not use drugs or surgeries. His data showed in the study group, average reduction in total cholesterol was 227 to 172. Reduction in LDL cholesterol is very significant. He saw a 4% regression in coronary stenosis, plaque in the arteries, and he saw a 91% reduction in the frequency of chest pain. Compared to the individuals that followed the standard diet, they got worse cholesterol. They had an increased frequency of chest pain, about 168%, and they had an 8% increase in plaque. So there's about a 12% difference between the two. So this has been shown scientifically for a long time. So how do we remove the vice grip? I'll give you one example. It's a 46-year-old lady came to see us. Now she was concerned about her weight. She wanted to get gastric sleeve done. She went and saw a surgeon for that, and they said, well, your EKG is abnormal. You need to see a cardiologist. So she came and sought us out for clearance to have gastric bypass surgery. She was having symptoms of chest pain, shortness of breath. We did an EKG. It was truly abnormal. But we scanned her heart and saw that she was in heart failure. So I talked to her and said, look, we need to take a look. We did a coronary angiogram, and I saw this. She had an 85% narrowing in the proximal segment of this very important artery called the LAD. So I was concerned about that because that's a dangerous place to put a stent. The main option for her would be single vessel bypass. I talked to her and her husband about the options, and they wanted to try lifestyle modification. I left that on the table as well. So she went through a lifestyle modification. remove all dead animal flesh and toxic food from her diet. And after about 5.5-month period of this nutritional cleansing, the stenosis had opened up. Not only that, her heart went from beating 20 to 25% to beating 50%. So her heart had healed itself, not based on any type of medication or any type of surgery, but based on simply removing the poison, removing the harmful agents, and she just simply got better. Okay, there's your before and there's your after. The food prescription for better health. Here's a schematic. I borrowed this slide from Dr. Esselstyn. Here's a plaque. And what happens is that you get a lot of swelling in the plaque. So as you start to nourish the body with natural food, the inflammation goes down and the swelling goes down, the plaque stabilizes. So this plaque, this artery opens up. It opens up naturally. That's what the body does. We've had over 1,000 people go through our programs, and we see typically about a 3 to 5% body reduction, 2 inches off the waist, significant reduction in blood pressure, reduction in hemoglobin A1C, and reduction of medications, about 25 to 67%. Do you know how long it takes us to get this? 4 weeks. Just 4 weeks. Okay? It doesn't take forever. Here's the graphs. I'll just go through this quickly. Systolic blood pressure, diastolic blood pressure. This is 4 weeks between 1 and 2. So the take-home message here is that when you eat natural, healthy food, it doesn't take 1, 2, 3, 5, 20 years. It takes days to weeks before the body starts to have meaningful changes and improvement. Inches off the neck, 2 inches off the waistline, all just in 4 weeks. A significant reduction in cholesterol in just 4 weeks. I can't get this when I prescribe a statin drug. Okay, LDL reduction. This is an important slide here. CRP is a measure for C-reactive protein. It's a decrease in inflammation. That's a 34% reduction in inflammation in 4 weeks. That's a very impressive change in such a short period of time. That's a reduction in risk of heart attack, a reduction in arthritis, etc. Sedimentation rate, again, a 33% reduction in inflammation in a short period of time. So hemoglobin A1C goes down as well. So the important thing is that the body heals itself in the setting of proper nutrition. So oftentimes people come and say, well, my mother had diabetes, my uncle had diabetes, and my next door neighbor had diabetes, so I'm bound to have diabetes. Families pass on diseases more effectively through recipes than through genes, okay? So we need to spend money undoing these lethal recipes as opposed to spending billions of dollars trying to undo lethal genes, okay? So what is the premier medical diagnostic and screening tool of the 21st century? I'm going to let you in on a major secret. You need to write this down. If you're asleep, wake up, stretch out, wiggle. This is going to save the life. This is a major tool. I'm going to get a patent on this pretty soon. And this discovery, this major tool that's going to save our lives is the meal plate. Now, why do I say that? The meal plate is very important because patients often come and say, well, doctor, I had a blood test and I had a CAT scan and this, that, and the other. And so it was all negative. So that means I'm healthy? I said, well, I can't guarantee you that because our diagnostic tools can only see so much. In my book, I talk about the hypothetical lady that wakes up in the morning, she has one cancer cell in her breast. And so she goes and get her blood checked, and she'll get a mammogram, she'll get an ultrasound, she'll get many tests, and they'll all be normal. But that cancer is still there. And it may take 7 to 8 years of doubling time of that cancer before it's first detected on ultrasound mammogram. So she's going to have 7 years of normal tests before her disease manifests itself. So the only way she can really ensure herself of not having that cancer is to remove the cancer from the plate. If you remove the cancer and the heart disease and the diabetes and the arthritis from your breakfast, lunch, and dinner plate, if you remove the dead animal flesh and the protein that's triggering this, that's where you're going to guarantee your health. So you need to scan your plate. You need to ultrasound your plate. Okay, test your plate, and then you'll be healthy. Now, what about that patient I told you about? Well, she had the angioplasty, she had surgery, but however, after surgery, she developed meningitis. That resulted in brain swelling, condition we call hydrocephalus. She needed to have a shunt put in. She had to put a VP shunt to drain the brain. That causes a bleed. She went into a coma. She had subsequent seizures. She had brain function, and I was, again, taking care of her. She had full recovery from this, but then she had a subsequent decline with more seizures. She had a fall as a result of a seizure, had more bleeding, had to go back to the hospital. She was placed on a ventilator. She had abdominal swelling. There was one night I was called in the middle of the night to her. She had swelling around the heart, and the blood pressure was dropping. Had to rush in and put a needle in her chest and drain blood from around the heart. She had more abdominal swelling, and she eventually died from liver failure 1 year and 10 months after the brain tumor diagnosis. And she spent most of that year and 10 months in the hospital, being sick and suffering. So even though we thought we had done a pretty good job, we were in the medical center, we did not do her the optimal service. I studied her case because I was concerned about it and found out that her liver failure was by and large due to chronic exposure to the standard American diet and too many medications. I won't go into the details of how I came to that, but I was pretty convinced based on my review of her case. But the most significant characteristic of this patient was that she was my mother. Now, my mother used to tell me when I was young, she used to teach me time and just go through my spelling words with me and all of that stuff. And she would say, son, I'll be your mother to the day I die. I didn't know how prophetic that statement was until, on her deathbed, she was teaching me the most important lesson that I would ever learn in medicine. And based on what I learned from her is what projected me into this area of what I'm doing. And the point I raised today is that we all need to put a face on this. This whole issue of illness and sickness, we may have a mother, we may have an aunt, we have children. We all have to put a face on this because either we're inheriting some bad lifestyle and passing it down to the next generation, but there's somebody that we know and someone that we love who's suffering. There's someone who we know and someone whom we love that we can save, that we can help. And, I think about my mother every day, but I don't feel bad. She was J.M., John C. Montgomery, but there's also another E.M. E.M. is a patient of mine, happened to see her a few weeks ago. She's 86 years old, and we started treating her. Based on what I learned, I advised her to go to a plant-based diet over 2 years ago. She's about 115 pounds lighter, lots of energy. Although she has a pacemaker from chronic living before, she's living independently. But recently she was able to attend her granddaughter's graduation at Spelman College. Now, President Obama was at Morehouse and the Surgeon General was at Spelman, and she was walking all over the place. An 86-year-old lady living independently, enjoying life. That's what life is about. And that's what we need to be about. We need to be about a better life. We're all going to die someday. People tell me, well, I can't eat this strange diet because I want to be happy and that type of stuff, and I'm going to die someday. You're not going to be happy eating that bad diet, okay? So it's all about getting from illness to recovery to wellness to fitness and a better you. Always work toward making a better you. I think that concludes our comments. Thank you very much for your comment, for your attention. Do I have any time for questions and answers? 5 minutes? All right, I think I have 5 minutes for questions, comments, smart remarks, personal time. Yes, ma'am.
I have questions about vitamin and mineral supplements. Do you suggest it, or what is your opinion on it?
The great question. The question is on vitamins and mineral supplements. Do I recommend it? I do not recommend vitamin and mineral supplements. And the reason is that our bodies don't recognize vitamins. For instance, our bodies don't recognize protein or carbs or our bodies recognize apples, it recognizes avocados, green beans, and spinach. It recognizes whole food. If I were to take vitamin C, if I were to look at a carrot and remove a vitamin C molecule out of the carrot, as soon as I remove that molecule out of its natural environment, something happens to its stoichiometry, etc., and its biochemistry is not the same as it is in that environment. So when I remove that vitamin or mineral away from its environment and put it in my system, I'm putting something different in my system. There's an interaction, a biochemical interactions of the molecules inside that carrot that we don't fully understand. So that's why we should simply eat the carrot and not necessarily the vitamin C or the beta carotene or whatever else we want to isolate. There are sometimes I do it in a medical situation. If somebody's potassium is very low, I'll supplement potassium or calcium. That's sort of in an acute medical situation. But on a chronic, stable situation, I don't do it. I just want to make that clarification. Yes, ma'am.
I'm reading a book by Dr. Dina And he says that canola oil is much better for you than olive oil.
Yeah. Well, you know, my opinion on oils in general is I don't recommend any oil. And there is some little divergence among the powers that be in terms of oil. If you talk to Esselstyn, he doesn't recommend any oil. But there are probably some nuanced benefit of canola oil. I tend to tell people not to consume any oils. You want to consume the whole food. In a similar explanation or reason why you don't want to extract vitamins, you really don't want to extract oils. The way oils are extracted, I mean, I don't know you buy canola oil off the counter, or they're heat extracting it. I don't know what's happening to it. That's one. Two, even if you use a perfect extraction technique, that oil by definition, once it's extracted from the plant, is incomplete. And so there are some nuances in terms of what you're dealing with. The body wants to see the oil in the context of the food. Any other question? I got one more. Yes.
What's your opinion on B12? How to get it from nutrition?
B12. So what's my opinion on B12? B12 is a little tricky because when you think about vitamins, you know, lots of people are B12 deficient. The issue with B12 is a bit more complex than do we need to supplement or not. B12 has a lot to do, the human body doesn't make B12. We rely on our bacterial flora to make B12. And so if our gut flora is not normal, then we're not going to make substantial amounts of B12. That's one. Two, if our GI tract is diseased, our microvilli are sloughed off, we don't have good absorptive capabilities, then we're not going to absorb B12 very well. And so these two issues are just two simple issues that affect our B12 level. What I tend to tell people to do is I'll check B12 levels. If they're very low, I'll supplement as needed to get them up to the normal range. I'll try to get my patients on a natural diet and see if they can maintain their B12 by maintaining a normal gut flora and normal absorption. But B12 is something that if the body is functioning in a normal setting, you can get it. You can also get B12 from fermented vegetables, things like sauerkraut or kimchi, etc. Any other questions? Oh, yes, ma'am. I'm sorry, this light's my eyes, so I need to, yes.
A lot of pain in my lower belly. What do you suggest?
A lot of pain in your lower belly. There's a gastroenterologist sitting in the audience. I'm going to introduce you to him. I'm teasing you. The pain, it can be due to a lot of things. I don't want to give medical advice, but it depends on, it's often, you want to think about what you're eating. If you've recently converted to a plant-based diet, then your stomach may be adjusting. If you're eating certain foods that doesn't agree with you, then it could be any one of a number of things related to what you're eating. But you should get it checked out, have it imaged or something like that. All right. Thank you very much. Oh, so one more question in the back. So your husband's concerned that if the kids don't eat fish and meat, they won't grow up? they won't grow up and leave the house. And now, it's plant-based foods. The American Dietetic Association has written a position paper. I think it was published in 2009. And may have been published in 2007, I forget which year, but they even stated that plant-based nutrition is healthy at every stage of life, including pregnancy. So plant-based nutrition is healthy for children. Not only do the children not need to eat dead animal flesh and dairy, but children need not to eat dead animal flesh and dairy. That's a very important distinction. One last question, they're going to yank me off the stage. Yes? Yeah, there is the PCRM is a good resource. In fact, they have there's one pediatrician I know of is plant-based, but Dr. Spock he's a famous pediatrician, went plant-based. But there's some good resources. That position paper by the American Dietetic Association would be a good place to start, because they strongly come out and say that plant-based nutrition is healthy at any stage of life, children, adults, pregnant mothers, etc., as well as athletes. So there's a lot of data out there. Physicians Committee for Responsible Medicine, go PCRM.org. That's a good thing. You can go on our website and I'll talk to her and chew her out or something. I don't know. But anyway, thank you again very much. Thank you very much for your attention.